Hello and welcome to our video on congenital heart diseases. Today, we'll be answering the most popular questions about this condition. So stay tuned and do not forget to subscribe and support our channel. Congenital heart disease refers to a heart defect present at birth. It is a structural abnormality that affects the heart's chambers, valves, or blood vessels. This can lead to problems with blood flow and heart function. Symptoms of congenital heart disease may include shortness of breath, chest pain, and fatigue. While some cases are mild and may not require any treatment, severe cases may need surgery or other interventions. It's important to note that congenital heart disease is not a result of anything the parents did or did not do during pregnancy. However, certain factors such as genetics or exposure to certain medications or chemicals during pregnancy may increase the risk. If you or your loved one is affected by congenital heart disease, it's essential to seek medical advice to ensure proper diagnosis and management. What are the most common types of congenital heart diseases? There are several types of congenital heart disease, but some are more common than others. The most common types of congenital heart disease include atrial septal defect, ventricular septal defect, and tetralogy of Fallot. Atrial septal defect is a hole in the wall that separates the two upper chambers of the heart. Ventricular septal defect is a hole in the wall that separates the two lower chambers of the heart. Tetralogy of Fallot is a combination of 4 heart defects that affect blood flow. Other types of congenital heart disease include pulmonary stenosis, coarctation of the aorta, and transposition of the great arteries. The severity of the condition and the necessary treatment depend on the specific type of congenital heart disease. It's crucial to seek medical advice if you or someone you know is experiencing symptoms or has been diagnosed with a congenital heart disease. What are the causes of congenital heart diseases? The causes of congenital heart disease are not always clear. In some cases, it may be due to genetic factors or certain environmental factors such as exposure to medications or chemicals during pregnancy. However, for most cases, the cause is unknown. Research shows that certain medical conditions, such as diabetes or rubella, during pregnancy may increase the risk of congenital heart disease in the baby. Additionally, family history of congenital heart disease can also increase the likelihood of a baby being born with the condition. However, it's important to note that in many cases, congenital heart disease occurs spontaneously, without any known risk factors or family history. It's essential to seek medical advice and undergo genetic testing if you have a family history of congenital heart disease or are planning to have a baby. Early diagnosis and management can significantly improve the outcome for those with congenital heart disease. How are congenital heart diseases diagnosed? Diagnosing congenital heart disease often involves a physical examination and a review of the patient's medical history. A doctor may also order tests such as an electrocardiogram, ECG, echocardiogram, chest X-ray, or cardiac catheterization to confirm the diagnosis. An ECG records the electrical activity of the heart and can help detect any abnormalities. An echocardiogram uses ultrasound waves to produce images of the heart structure and function. A chest X-ray can provide a clear picture of the heart and lungs, while a cardiac catheterization involves inserting a thin tube into a blood vessel and guiding it to the heart to measure blood flow and pressure. These tests can help determine the severity of the condition and the best course of treatment. If you or someone you know is experiencing symptoms of congenital heart disease, it's essential to seek medical advice and undergo the necessary tests for diagnosis. What are the treatments for congenital heart diseases? The treatment for congenital heart disease depends on the severity of the condition and the specific type of defect. Mild cases may not require any treatment, while severe cases may need surgery or other interventions. Some treatments may include medications to control symptoms or improve heart function, while others may involve surgery to repair or replace heart valves, close holes in the heart, or improve blood flow. In some cases, a heart transplant may be necessary. Treatment may also involve lifestyle changes such as maintaining a healthy weight, quitting smoking, and regular exercise. It's important to work closely with a medical team to determine the best course of treatment for each individual case of congenital heart disease. Can congenital heart diseases be prevented? Preventing congenital heart disease can be challenging as the causes are often unknown. However, there are some steps that expectant mothers can take to reduce the risk of their baby developing congenital heart disease. These may include maintaining a healthy diet, avoiding exposure to harmful chemicals or medications, and managing any medical conditions such as diabetes or high blood pressure. Additionally, Genetic counseling and testing may help identify any potential risk factors and provide guidance on how to manage them. While it's not always possible to prevent congenital heart disease, early detection and treatment can significantly improve the outcome for those with the condition. What are the long-term effects of congenital heart diseases? The long-term effects of congenital heart disease depend on the severity of the condition and the individual's overall health. Some people may experience few or no symptoms and have a normal life expectancy, while others may require ongoing medical management and monitoring. Complications associated with congenital heart disease may include heart failure, arrhythmias, and increased risk of infection. In some cases, surgery or other interventions may be necessary to manage these complications. It's essential to work closely with a medical team to monitor and manage any long-term effects of congenital heart disease and make any necessary lifestyle changes to maintain optimal health. What support is available for people with congenital heart diseases? It is important to have a support system in place when dealing with congenital heart disease. This condition can be overwhelming for patients and their families, so having a strong support system can make a big difference. Support can come from various sources, including family, friends, and support groups. Support from family and friends can be very beneficial, as they can provide emotional support, help with daily tasks, and be a source of encouragement. It is also helpful to have a support system that includes other people who have gone through similar experiences. This is where support groups come in. There are many support groups available for individuals and families dealing with congenital heart disease. These groups provide a safe and supportive environment for sharing experiences, information, and resources. If you are looking for support, reach out to your healthcare provider, as they can connect you with local resources and support groups. Additionally, online communities and forums can be a great source of support and information. Remember, you don't have to go through this alone. There are many people and resources available to help you along the way. It's important to remember that living with congenital heart disease can be challenging, but it doesn't have to define you. With proper management and support, individuals with congenital heart disease can live full and active lives. It's important to stay informed about your condition, follow your healthcare provider's recommendations, and make lifestyle changes as needed to manage your condition. It's also important to prioritize self-care and mental health. Managing a chronic condition can be stressful, so taking care of yourself mentally and physically can help you better manage your condition. This can include things like getting enough rest, eating a balanced diet, engaging in physical activity, and seeking mental health support when needed. In conclusion, congenital heart disease is a complex and lifelong condition, but it can be managed with the right support and resources. If you or a loved one is living with congenital heart disease, reach out to your healthcare provider for guidance and support. Remember, you are not alone, and with proper management and support, you can lead a full and healthy life. Thank you for watching, and don't forget to subscribe to our channel for more informative videos like this.